Good evening. Good evening, everyone. On behalf of Association of Pharmaceutical Teachers of India, Kerala State Branch, I extend a warm welcome to all the participants, distinguished guests, faculty members, and resource person joining us through Zoom for today's session of the Faculty Development Program on 360-degree understanding of the revised PCI B.Pharm curriculum under NAP 2020. Today, we have two sessions, evaluation and credit framework by Dr. Raja Chakraborty, professor and head Assam Don Bosco University, and electives and emerging courses by Dr. Sajindra L. Nargun, director and principal, Nargun College of Pharmacy. And now it is my privilege to introduce Dr. Sujith Nair, today's chairperson. Dr. Sujith Nair is currently serving as the Vice Principal and Head of the Department of Pharmaceutics at the Crescent College of Pharmaceutical Sciences, Kannur, Kerala, and is the Vice President of APTA Kerala State Branch. He completed his undergraduate and postgraduate studies under the Rajiv Gandhi University of Health Sciences, and brings with him more than 22 years of rich teaching experience at both undergraduate and postgraduate level. He is an approved PhD supervisor under KUHS, AJTU, and Vinayaga Mission Research Foundation. His academic contributions include more than 50 research publications in reputed national and international journals, 3 patents, and 3 authored books. Dr. Sujith has actively contributed to several professional organizations, including APTI, IPA, IACP, KPGA, and IPGA. He has served on the scientific committees of numerous national and international conferences and has held key academic positions with the Kerala University of Health Sciences, including BG Board of Studies, faculty member in recognition of his outstanding contribution of pharmacy education. He was honored with the prestigious Best Teacher Award 2025 at the Faculty of Pharmaceutical Sciences, Kerala University of Health Sciences. Sir, we are grateful for your presence. With that, I now hand over the virtual microphone to our respected chairperson, Dr. Sujith Nair, for his presidential remarks and to take the session forward. Over to you, sir. Thank you.
Okay, thank you, Vajid, sir. Once again, I warmly welcome all the faculty members to the second day of the Faculty Development Program, the Pharma Syllabus 360. So in this today's session, we'll be discussing, the first session will be discussing the evaluation and credit framework. And this session is going to handled by the resource person, Dr. Raja Chakraborty. And the revised curriculum mainly represents a transformative shift from a content-based education approach to a competency-based, outcome-oriented, and student-centric learning system. So this curriculum emphasizes flexibility, innovation, practical exposure, interdisciplinary learning, and professional skill development through the implementation of choice-based credit system, outcome-based education, structured internship, experiential learning, research project, and continuous assessment mechanism. So in today's presentation, it's more focus on the major reforms introduced in the curriculum, including CBCS implementation, continuous internal assessment, semester and examination patterns, rubrics-based evaluation, the OBE framework, internship structure, research component, field visit, and experiential learning opportunities that all collectively aim to bridge the gap between academia and professional practice. So today we have an eminent resource person, Dr. Raja Chakraborty. He is already actively involved in the preparation of the new syllabus, Pharma Syllabus 2026. So it's my privilege to introduce our esteemed resource person, Dr. Raja Chakraborty. So Dr. Raja Chakraborty is currently serving as professor and principal at Institute of Pharmacy, Assam Don Bosco University. He holds an MPharm and PhD in pharmaceutical sciences with specialization in pharmaceutical chemistry. and possesses over 16 years of teaching experience, research, and academic administrative experience in reputed pharmacy institutions across India. His research interest includes medicinal chemistry, traditional medicine, phytochemical profiling, oxidative stress, and metabolic disorders. Dr. Chakraborty has authored and edited several internationally acclaimed books and has published more than 85 research and review articles in reputed journals. He has also contributed extensively through book chapters, conference proceedings, and invited lectures at national and international conferences. He served as a co-principal investigator of DBT-sponsored networking project on herbal medicine and has guided several PhD scholars. In recognition of his academic excellence, he received the Dr. APJ Abdul Kalam Award for Teaching Excellence in the year 2018 and was listed among the global top 2% scientists by Stanford University and elsewhere in the field of medicinal and biomolecular chemistry. Dr. Chakraborty is actively associated with several professional scientific organizations as a fellow, reviewer, editor, and academic mentor. So on behalf of all the participants, I extend a warm welcome to Dr. Raja Chakraborty and invite him to deliver his expert insight on the evaluation and credit framework under the new B.Pharm syllabus 2020. So before start, a note to the participants, if you have any queries or questions during the session, you can post in the chat box that we will be discussing at the end of the session. When you are posting the posting the questions, make sure that you are posting the question which is related to today's session or topic. Over to you, sir. Thank you.
Thank you very much, sir, for a brief introduction. I just want to share my screen. Is it visible, sir?
Yes, sir. Yes, sir.
Okay.
Yes, sir. Okay.
A very warm good evening to everyone, and I really thankful to the organizing committee to invite me in this series of lectures of the FDP, the implementation of the new syllabus. So this is the time that we are crossing over to the CBCS system, to the new NEP system of education, where it's a big, I feel it's a big crossover. It's a big crossover and transfer from the upgradation process of our new syllabus to the new aligned frameworks. In this framework, we feel that there will be a lot of things has been included, including the knowledge, skill, and the industry readiness of the students, outcome students who will be going to implement this syllabus. So it's not just an understandable thing that what we are going to change and why we are behind this shift. What is the reason behind that shift? If we come to the paradigm shift in 2014, that we have observed that the fundamental things was shifting in this education system. The pharmacy education is no longer just about memorizing the theoretical monographs. In 2014 models that they have served us with providing theoretical depth. However, in the present model, it is driven by the NEP 2020. We are going for an outcome-based, skill-oriented models and a knowledge-centric approach for a digital-ready pharma education, which will be industry-integrated pedagogy. We are not only going to prepare the student for the skill and knowledge, we are also making them to align themselves to the recent trends of AI in respect to their education as well as in respect to their research. So in 2026 NEP syllabus, it will make the students especially digital ready, industry integrated, and research driven pedagogics. So what are the core objectives of this 2026 new syllabus? We are going to have 12 credits to focus the research focus and innovation and scientific inquiry. We are also going to make 240 hours of internship in industry and hospital and clinical settings, which was previously half of these hours, to make them industry ready. And we are also make the students digitally competent by integrating the AI, Python programming, and machine learning across the all semesters. Not all semester, alternative semesters. So this will be our main part to main objective of designing the syllabus, new syllabus. So where the systems are going to change, what is the main change that we are going to give? In the system that will be previously, it is CBCS system. Now this system will be NEP aligned CBCS. The philosophy previously it was knowledge based. Now it will be transferring to the competency and outcome based. Previously, the primary focus was traditional pharmacy education, but now our primary focus it will be a digital pharmacy, AI integrated modifications, adoptions, and development of the entrepreneurship in the students community. So the admission criteria it was remained same what was there in the previous PCI 2014 regulations and present NEP 2020 regulation. Generally there will be a philosophy shift. In this framework we are going to make these graduate attributes ensuring the students that will not be going for just a degree holder. Along with their education regular education process, we have integrated some components which will make them industry ready, which actually the main aim for designing the syllabus, as well as to align with our modern generation. Every field is integrating AI in their field. If you go for any other courses or programs, we observe that the integration of AI is becoming a common thing for all around other subjects. So it was also ensured that our pharmacy students should not left behind. They also can come to know about the AI integration, their benefits, and the things they are going to strategically do for the betterment of this pharmacy field, pharmacy professions in coming time. So that we should not, after 5 or 6 years, we should not say that yes, other peoples are using AI and the pharmacy students are not aligned themselves with the new things that is coming in AI. So there is also an philosophy shift for designing the new syllabus. So previously, semester duration it was 100 working days, but now it's changed to 19 working days, and it is effective because it will be having an intensive learning along with this 90 working days. In some cases, why it was changed, because the industry component was included, where it was more time was given for the students to explore themselves in the industry and outer field outside of the knowledge campus. And previously the attendance rule was 80%, it was mandatory, and it was shifted to 75%. In considering, it feels that several regulatory authorities also make this 75% as a minimum criteria to appear for the exam. So that has been changed from 80% to 75%. Previously it was having 209 credit, 211 credit, and 212 credits. 211 credits and 212 credits is due to the integration of the biology and mathematics, and now it was fixed as 193 credits because biology and mathematics was removed from the first year. And this reduction in the 17 credits, it gives more emphasis in the experimental learning, focusing on the more modern subjects. We in that reduction in the credit points also emphasize that we have changed the structure in the theory as a tutorial subjects that was not included presently in the tutorial subjects. Now this is the gist where the changes has occurred. In the semester 1, 27, 29, 30 previously, and now it is 21. So there is a reduction of 6 credits in the first semester. In the second semester, it was 29. Now it is 26. There is a reduction of 3 credits. In semester 3, 24, there is an increase of 1 credit in semester 3. And in semester 4, again, it is a reduction of 5 credits. Semester 5th, reduction of 4. Semester 7, there is also an addition of 2 credits. And semester 8, there is an addition of 2 credits. So if we just compare total credit points, we can observe there is a reduction of 17 credits in compared to the PCI 2014 CBCS syllabus. Now, where we have shifted, where we have changed the credit points, and what was the benefit that we have observed, and which subjects we have removed, and what the additional things that we have added in the new things. So the remove components from the previous syllabus, it was tutorials, practice school was removed, remedial biology and mathematics was removed, and the new addition was done in the new syllabus is structured internships, AI ML in pharma, and startup ecosystem. So these are some subjects has been added in the new editions, which is actually required for the aligning us ourselves with the modern era. In the credit rules, one lecture was there for 1 credit, that was remain same. 2 practical hours was 1 credit, that is also remain same. 30 projects and internship hours, there will be assigned as a 1 credit, and if it is according to that, there has been given the credit system for the 2 internships, because from now onwards, from with the new syllabus, there will be 2 internship in the 4th semester and 6th semester. So lateral entry comparison, previously in the 2014 syllabus, there was an addition of 52 credit points who was completed their courses, but presently it was 49 credit points who is going to complete their DPharm and joining as a lateral entry. So in the bridge courses, communication skill and computer application was added previously to gap the to just remove the gap between the diploma courses and lateral entry subjects in 3rd semester onwards. And now it was added Python, healthcare psychology, and data analysis. That indicates, this means that any students who complete their diploma and join their 3rd semester as a lateral entry, in additional to the 3rd semester subjects, they have to take this subject additionally to just fill the gap what they have not completed during 1st semester and 2nd semesters. So total transfer, the credit is 59, and in the new syllabus there will be 47 credit points will be credited. So which under this, which one 41 will come from the diploma, and the remaining 6 credit will be from the additional subject they are going to take in their 3rd semester. So this addition was made by keeping the concentration that the new students who are going to come from the diploma, as diploma syllabus is not revised, or maybe some component will be there in that, but presently to prevent the or to bridge the gap, this AI subjects and digital competencies subjects was added in the 3rd semester. So what are the significant changes in the semester 1 upgradation? So here we have, it has been removed, remedial biology and mathematics was removed. Introduction of the basic Python programming with 2 credit, healthcare psychology with 1 credit was added. And this shift was making due to the making the students for the competitive with the digital era from the 1st semester onwards. So here is the changes in the practical the theory components in the old syllabus. These are the subjects was there with the 10 practical credits added. Now there will be practical credit will be 5, and these are the subjects was added in the 1st semester. So these are the main differences in the 1st semester. If we go to the 2nd semester, here what is the concentration, what has been concentrated on is, we have applied the analytical data analytics in applied biostatistics, which will also help in understanding the AI subjects in the upcoming semesters like machine learnings and all. In the physical pharmaceutics, the shifting was done for the later semester for the pharmaceutics, and for a pharmacognosy, it was introduced here in the early semesters to make them understand about their botanical knowledge. So if you see over here, these are the subjects has been added and practical was there. Pharmacognosy subject was added in the semester 2. If we come to the semester 3, what are the main things was added? Here actually has been concentrated about improving the intelligence of the students, where the machine learning was added with 2 credits, human values was added with 1 credits, and the doses from revised nomenclature and credit alignment was done for this. So here the new subject has been added, introduction of the machine learning with 2 credits, ethics and human values with 1 credits, and environmental sciences it was added to the 1 credit. So these are the new theory syllabus has been added. So previously it was 6 practical hours. In presently it is having no, sorry, this has been changed. Yeah. So here again the AAC subject was added with the nutraceuticals, fundamental food, food analysis, yoga, and life sciences. So there is an AAC subject along with the existing these subjects a person can choose. This is fundamental foods, food analysis, yoga, and life sciences. This is the practical AAC subjects has been added. Now coming to the semester 4, what are the concentration was made on the social responsibility. So there will be a mandatory internship which contains the 4 credits, and a social pharmacy subject was added into this with 2 credits, and the biotechnology subjects was shifted to the previous semesters from this semester for uh, aligning with the syllabus. So here about the old PCI syllabus, there is new subjects are social pharmacy, public health, pharmaceutical, biotechnology theory was added, and was mandatory internship with 4 credit was added into this. So previously there was no internship. Practical hours was 8 hours, but here the practical hours is 5 hours, and the internship was added 4 hours. So this actually indicating that the shifting of a laboratory practicals to the industry oriented experiences. In the semester 5, the main concentration is about the innovations. So biomedical chemistry was emphasized the biomedical aspects aligning with the clinical aspect in the subjects. There was an innovation and startup ecosystems subject is added with the 2 credits, where the pharmacist will be experiencing to in the entrepreneurship and innovations. So these 2 subject was added, innovation and startup ecosystem theory with 2 credits, and pharmaceutical quality assurance with 3 credit was added over here, but the practical components was remain same. So after completion of the semester 5, a student will be start thinking about the innovations startups from the semester 5 onwards. So in semester 6, the main concentration was done with the digital mastery. AI application was done, deep dive in the AI with the new subjects has been added, AI applications in pharmacy theory with the 2 credit. IPR focus, a dedicated subject in intellectual property right was added, and the second internship will be is added in this, so that they can continue their internship experiences extensively with the industry. Here if you see, the practical hours is not drastically changed, but an internship hour has been added into it. So these are the changes done in the 6th semester, keeping this mind to make the students more digitally active, digitally aware. And in semester 7, the concentration was made to make the students advanced in analysis. So pharmacovigilance subject was added into that as a core subject with 3 credits. AI in clinical pharmacy it was added, and regulatory affairs subject was added in this. Here also we can observe one AAC subjects with a 1 credit. They can have an option to select the subject in a number of options. So this biostatistics research methodology, pharmacovigilance, and this cosmetic and cosmeceutical theory will make them advanced in the data analysis. If we go to the 8th semester in the future frontier, the concentration was to make the students for the ready for the future, ready for the industry. So clinical pharmaceutics with the 2 credit was added. Sterile dosage form was concentrated on this semester, and AR/VR applications was added in a Pharma 4. So if you see over here, there are the clinical pharmacotherapeutics, industrial pharmacy, ethical transition of AI in pharmacy, sterile dosage form. These are the subjects has been added with in 8th semester. So credit movement summary here, the credit reduced in the basic chemistry, transitional pharmacognosy, repetitive pharmaceutics and practice school. 11 credit was removed, whereas AIN ML 8 credit was added, internship 8 credit is added, research project 12 credit was added extra, entrepreneurship 2 credits and social pharmacy. So these are the main credit shift was done in the new syllabus. So here the structured internship that we have, total 240 hours of mandatory practical training that has to be spreaded over 2 semester, semester 4 and semester 6, and the evaluation mark, it goes 100 marks, 75 marks on the report and 25 marks on viva. So the new research project, 6 credit in semester 7 it will start, preparation, literature survey, methodology, setup, all this. 6 credit in the semester 8. So this 12 credit was added in the research project, whereas the previous credit was 2024, it was 6. So the credit in the research project, it was doubled. So program educational objectives. So what actually our objective of this program in educational objective is to implement the knowledge. So the PEO 1 was applied as a applied pharmaceutical knowledge and practice in industry. So we have concentrated on the skill in PEO 2 and PEO 3, ethics in PEO 4, and professional development in PEO 5. So these all PEOs has been included. Concentrating on this, the new syllabus was designed. So these are the program outcomes where it has been integrated the new era along with their social developments and their skill development, entrepreneurship developments. Though concentrating on this, the PO has been designed and the PO lifelong learning was added from the SDG. So outcome monitoring, previously the Bloom taxonomy assessment was there, but in the Miller's pyramid it was not done. So here in the frameworks, we have concentrated on improving the clinical competence from knows to does. So this actually Miller's pyramid was followed in this evaluation monitoring system. So there is an internal examination committee where the composition is principal. It was newly introduced, and the role here specifically given is modernization of the question paper, outcome based assessment monitoring, and grievance redressal. So meeting before it was before each sessional and semester exams. So these are the new things has been introduced for implementing the outcome based assessment monitoring. So these are the major changes in internal examination committee. In old PCI, no separate internal examination committee was there. Here the new introduction of internal committee. Chairperson will be the principal or head of the institute. Program committee, it was not mentioned. It was mentioned, but the roles and regulations was not clearly mentioned. So BPharm coordinator, it will be a member secretary, and new role has been added into it. Examination cell in charge, it was not included in the new committee. It was included. Modernization of the question paper, outcome based assessment, grievance redressal. So these are the newly introduced measures which has been done in the new new syllabus, PCA syllabus 2026. So here if we come to the evaluation, so 4 credits, if it is 100 marks, internal assessment was 40, external assessment was 60. For the 3 credit, it was 30 and 45. Total mark is 75. For 2 on 1 credit, the internal is 20, external is 30, and the total marks it carries 50. So previous it was totally based on the credits. The internal and external mark system has been done. So these are the internal assessment pattern. What will be the question pattern for the different subjects which carries different credit points, and the duration has been given over here. So these are the internal assessment parameters. which is more or nearly the similar, but the marks and the credit distribution has been changed. This is the external assessment pattern for the theory, external assessment pattern for the practicals, evaluation of the dissertation books and presentation. This is about the dissertation presentation and dissertation book, total 60, and it is presentation is 90. So external assessment pattern, what is the changes has been happened? 4 credit course, it was not applicable before, now it has been added here in this pattern. So the quiz, assignment, open book test, field work, group discussion, seminar, all these things was also previously there. Now it is has been also retained same. Attendance, old PCI format, it was 95 to 100%, 4 marks. Minimum attendance was 80%. This remains same, that highest attendance category, but the minimum attendance was reduced to 75%. So who is availing 75 below 75% will not be eligible to get any marks in this category, whereas previously it was 80%. So here the internal assessment pattern. Previously it was 2 sessionals. Now also it is 2 sessional. There is no change. Average considered, previously it was no change in average. Theory sessional marks 30 marks. It was converted to 15. Now it is credit based 10, 15, 20. It is has been modified accordingly. Practical sessional, it was 40 marks converted to 10. Now it is new syllabus. It is 10. It is retained same. So here the progression and carry forward. So here I have given a name, that is hard top. So here the flexible progression, there will be every student who is getting pass from the first semester to 7th semester, they can promote to the next semester if they get any back exam also. But previously it was like that, if any students having any back exam is not clear for the first semester, cannot be promoted to 5th semester. It has been removed. Now can carry forward up to 7th semester. They have to clear all the subjects till 7th semester. So it has been basically given as a name, hard stop. Now the grade system, it was remains same what was there before. So these are the major changes happened, was done in this syllabus. Credit system, previously it was CBCS, now it is NEP based CBCS system. So updation on the framework was done. Course category, previously it was theory, tutorial, practical, practice school and project. Now theory, practicals, internship and projects. Theory credit calculation, 1 lecture hours, 1 credit, 1 tutorials, 1 credit. Now 1 lecture hours is 1 credit. There are tutorial subject was removed. Practical credit calculation, 4 practical hours, 2 credits. It remains same. There was no change. Tutorial component, it was not included in the new syllabus. Internship credit assessment, 30 internship hours, 1 credit was mentioned with a specific formula. Project credit assessment, it was same, remains same as a internship credit. Fractional credit rules, is a fractional 0.05 rounded down. It will be rounded down if it is below 0.05. So previously it was not specified. Minimum credit for the B.Pharm degree 209, 2011 and 2012 212, whereas presently it is single 193. So there is a reduction of 7 credits. Credit components, it was their theory, tutorial, practical, practice school and projects. So now it has been changed. More experimental learning was concentrated in the new subjects. So practice school, it was included previously in the 7th semester. It was removed now, which has been replaced with internship. Research emphasis was limited. Now it was increased. At the credit point was increased from 6 to 12. Industry exposure, it has been structured instruction and the specific instruction was included in the exposures. Lateral entry credit, 52 credit will be transferred. 41 credits will be transferred in the present system, NEP 2026 system. Additional course in the lateral entry, it was changed. Previously it was communication skill, computer application in pharmacy. Now it is healthcare psychology, communication skills, Python programming, biostatistics and data analysis. So in the digital skill, previously it was basic computer application. There was only one subject related to computer in the previous syllabus. Now extensively it was added in the 4 semesters. along with the elective subjects. So previously the curriculum generally it was focused on theory oriented and practical oriented. Now it is a skill, internship and research oriented. Previously NAP was not complied, but now it is fully complied with NAP 2020. Digital screen training, basic computer similar application, now it is advanced. Curriculum focus, it was simply okay, it has been repeated. Okay, now what is the benefit that we are going to expect, we are expecting from 2020 upgradation? First is employability. With the direct exposure to the new system, new era, AI and machine learnings, we are expecting that the employability will be increased, and global parity will be also increased in the new syllabus system, and the students are also going to have a soft skill and leadership in alliance with the new syllabus. So here the future ready pharmacist is the main target for the new syllabus of PCI. This is some glimpses of my organizations. Thank you, and I rest over here. I feel it can be open for discussion.
Okay, thank you, sir. Thank you for your what you call brief explanation about this credit and the examination pattern. So you have explained about your introduction of choice-based credit system and OB evaluation. And also you have explained about the internship pattern and credit system, how it's going to be evaluated, and give the importance of startup innovation and research in the new syllabus. Now, if anybody is having any queries related to all this, you can just post the questions in the chat box, or you can raise your hand and ask the question. It's better to post in the chat box. Any questions you have.
Good evening, sir.
Yes,
Sir,
sir.
good evening.
Sir, you explained about, and now the current syllabus is more focusing on experiential learning, right?
Yes,
So,
sir.
you said in the slide that it will enhance the employability. Like that, whether the research aptitude of students also will increase with this study, because the current syllabus is emphasizing on the research project, internship, etc., right? So the research aptitude, whether it will increase or whether it may lead to the publishable research outputs.
So if you observe over there, sir, I feel the credit point has been changed or increased from 6 to 12 in the research projects, which is just continued for the two semester, 7th and 8th semester. Importance of the research was increased double in respect to the credit. So here, especially the concentration was made for the internship, so the students can go and see what is the real life experiences are going on in the industry. And the second part, it was also emphasized with the research projects for the 7th and 8th. Previously, there was a practice school, which was actually the literature review and something, which has been removed in the new syllabus, and purely research oriented 2 semesters was given with 12 credits. That means 6 credit one is system. So 6 hours it will be definitely in, sorry, 12 hours it will be per week for the research for entirely 2 semesters.
Okay, sir, thank you.
Sir, there is a question in the chat box.
Yes, sir.
By Dr. Badganaman. Respected sir, can you brief little more on structured internship? In what way it is strengthened?
Okay, if I my slides are visible, I feel.
No, sir.
It was included in the 4th semester and 6th semester. If you see here, it was an internship. There was no internship over here, and the mandatory internship was given for with the 4 credits. That means they have to go for 120 hours of 240 divided by 120 hours of internship extended for 1 month. And here also, if you see, the mandatory internship was added in the 6th semester. So the internship category was given, like in the pharma industry, they can go for food processing centers, they can go for community pharmacy, and they go for any other healthcare related, even AI, any AI integrated companies where they are working with there, because we are moving towards there. So those internship criteria, depending on the choice of the student, depending on the interest of the students, they can go and do their internship extensively in two different areas. Now the question over here comes that why in two semesters? It was divided in the two semester. If any students want to do one internship in AI, another internship in hospitals, or any other sector related to the medicine, they can also do one internship over there. So they will be having an option to explore themselves in two different areas compared to previous year in one area. And it is previously it was concentrated on, I feel, maximum case in the industry. So now they have two options. They can continue in industry one internship, another in any other place of interest. So in elaborate syllabus it was given like this, where they can continue their internships.
Okay, any other questions?